case. This is very important case. A case of 6-year-old child came from Assam having complaint of the day blindness. This case is I am dealing for the first time day blindness. Night blindness like બે કેસ જોયા હતા આપણે થોડું રિલીફ ડે બ્લાઇન્ડનેસ નો પહેલી વાર મારી પાસે આટલા કેસ આવે છે. ઓકે, પેશન્ટ couldn't see in daylight. અને પેશન્ટની કઝિન સિસ્ટર મારી કોલેજમાં એ પેશન્ટ હતી અને એને હેરફોલ ને બધું હતું એને સારું થયું એટલે એને પછી એના આસામમાં રહેતા કઝિન બ્રધર જે પ્રોબ્લેમ હતો એટલે એને અહીંયાથી બોલાવ્યા ગુવાહાટીથી આવ્યા. I have taken all these things. The important points are only given in this. બહુ લાંબી રીતે પણ મેં આટલા પોઈન્ટ લીધા છે. So patient couldn't see in daylight. Was having blur vision, but he could see in night and darkness, as it is day blindness. Okay. Initially, it was diagnosed as a simple myopic astigmatism, and he was given simple eye glasses to correct the refractive errors. Right. Then he went to many various ophthalmologic institutes of the India, well known Sankara Netralaya ne badhe jagah હતા, but they only prescribe some correcting glasses, nothing else, right? And then ultimately some ophthalmologists suggested you do ERG, so electroretinography, and finally from the electroretinography the diagnosis was made with cone rod dystrophy. In retina there are two types of these cells are there, cones and rods. These cone cells are always very sensitive to lights, and in sunlight it is very sensitive, they work in sunlight, and these rods are usually active in the night. So the night vision rods are very important. These cones and rods are usually, they convert the photons, the image that is comes in the form of the photons. They convert this photon into the electrochemical stimulants, and that goes to the CNS, and then we can visualize, we can understand the vision. Right? So this is the physiology of vision, how we can see. So for the physiology of the vision, cones and rods are very important. So here in this case, cone rod dystrophies. Sometimes it is reverse. Here the rods are more dystrophies than the cones, right? So he can see, he cannot see in daylight, right? And reverse પણ હોય છે. The reverse હોય છે night blindness ની અંદર હોય છે. So this way, this is the physiology of this type of the. It is retinitis pigmentosa is little bit different between this thing. Retinitis pigmentosa is many times very common. These cone rod dystrophies are not very common. So ultimately they went for ERG, electroretinography, and finally was diagnosed common. Present complaints: blurred vision. He cannot see in daylight but can see in night and darkness. This is the report. Not able to see in sunlight and blurring of the vision. Okay. Sign of cone rod dystrophy. They have prescribed multivitamins and correcting glasses. And visual disability certificate પણ એને લઈ લીધું, physically disabled. So some more advanced investigations. This is also advanced investigations as done. Okay. See the progress of the disease. Previously, 31st March 21, he has given cyclical cylindrical 2 point, and in on 23rd June 22 it was 2.50. So it is increasing in number. Even the axis is also there, even the spherical also increasing. So number એના વધતા હતા, vision થોડું disturb થયા જ કરો day by day. And the ophthalmologist advised toric lens for constant use. We have taken all these generalities. Appetite reduced, thirst is reduced, tongue is clear, desire for sweet, chocolate, sugar and warm food. Aversion to vegetables and spicy foods. Stool is okay once or twice a day. Urine 5 to 6 in the day. Night there is no urination, perspiration on the forehead and slips on the sides, salivation and grinding of the teeth. This is the physical journals has been given by the patient. Family history. Family history is very important. Family history of mother is having migraine and tennis elbows. He is a very good tennis player. Father NAD, grandfather paternal diabetes, mellitus and hypertension. Grandmother diabetes, hypertension, thyroid and blindness. So it is blindness is inherited. Okay. Grandmother maternal ischemic heart disease, stent in heart and gout. Right. Auntie, maternal auntie, asthma, eczema and sinus. And mother's uncle is having CA. So this is the family history. History of mother during pregnancy. Genetic છે આટલું બધું છે એટલે આપણે પૂછવું જ પડે, રાઈટ? સો બ્લીડિંગ ઓન ધ આની જે પ્રીવિયસ પ્રેગ્નન્સી હતી આ પેશન્ટનું જે કન્સેપ્શન રહ્યું એના પહેલાની પ્રેગ્નન્સીનું છે. બ્લીડિંગ ઓન ધ ફર્સ્ટ ફ્યુ ડેઝ આફ્ટર કન્સેપ્શન બીકોઝ શી હેડ ડન camel riding while on vacation. So એ વેકેશન પર ગયા હતા અને કેમલ રાઇડિંગ કર્યું અને એને બ્લીડિંગ થયું and that conception has missed. And immediately after 2 months, she again conceived, and this is the patient. Okay, husband was the second conception. But the husband was not excited with the news of this conception. History of full-term cesarean section because of want of labor pain. Pitocin injection પણ આપે, ઓક્સિડેશન ના પણ labor pain નહીં થયું, so they goes for CS. So I asked whether patient has cried immediately or not. So patient cried immediately after birth, but mother is not sure if she had given colostrum or not. Colostrum, that is the most important vaccination for newborn. So I always ask, aapyu check nathi, right? We have also a medicine from colostrum. St. George pharmacy mati male છે colostrum. So whenever there is a history, I can give this colostrum in intercurrent as an intercurrent medicine. Okay? And she fed him for 2 years. But the milestones, all the milestones, the dentition and walking, talking, everything is normal. Mentally, patient is very, very restless, very hyperactive, cannot sit at one place. મારા ક્લિનિકમાં પણ આવે, આગળ પર વેઇટિંગ રૂમમાં જાય, અંદર આવે, રમતે રમતે પૂજા કરે, સામે તારો એક્ઝામિનેશન જે બોલે તેના પર પણ ચડી જાય. So very active, hyperactive. Asking many questions also, very loquacious, very obstinate, angry and striking others. અને હિસ્ટ્રી લેતા હતા પેલા બધા આપણે હિસ્ટ્રીમાં બધી વાર લાગતી તો તેના મધરને મારતો હતો કે ચાલો હવે જવું છે, ચાલો જવું છે, કેટલી વાર છે. This scenes always happens in many of us in clinic, right? Sometimes angry on himself. There is aversion to bath and even brushing teeth. એક સાહેબ એક ઘણી વાર તો નાય નહીં, મારે એને કમ્પલસરી ખીચવાઈને બ્રશ કરાવવું પડે, બ્રશ પણ નહીં કરે છે. સાહેબ એના દાંત જુઓ ને તમે એને સલાહ આપો કે ભાઈ રોજ બ્રશ કરવા, સલાહ આપશો. This is my prescription. Lycopodium 1 mg, 1 dose, SL for 15 days, and after 15 days, I cover this syphilitic miasm, right? Syphilidum 1 mg, followed by Lycopodium 10 mg. I am dealing with this syphilitic progressive disease, progressive day blindness. So vision is constantly losing and the number is increasing. So we have to bombard this case. We cannot wait for, okay, 1 mg 1 dose, wait for 6 months or not like that. Are you with me?
Yes.
So, but no improvement. SL for 1 month, no improvement. Then I switch over to Lyco 50 mg. 1 dose, SL for 1 month. No improvement. Then I have given Lyco CM and SL for 2 months. Then the improvement started. Now let's see how he improved. Lycopodium in the body, day blindness in the eyes. Day blindness is given. I will give you some repertory chart also. I have taken this type of the rubrics: mind, obstinate, headstrong, mind loquacity, he is inquisitive, restlessness, nervousness in children, striking in anger, generalities, bathing, washing aversion, vision blurred, vision loss of vision, brightness, daytime, extremity, dryness of hands, palm. Yes, these symptoms comes after second or third follow. So पहली हिस्ट्री में मैं नहीं लगी, but dryness of the palm and hands is second के third follow के अंदर आया. So I have included in this rubric. Okay. Generally, it is food and drink, warm food, cooked food desire. Okay. So these are the rubrics, and this is the medicine. Lycopodium. Finish. Simple case. Now this is after the Lycopodium CM. એના ગ્રાન્ડફાધરે એક ટેસ્ટિમોનિયલ મોકલ્યું છે. જસ્ટ થોડુંક એમાંથી ક્લિપ્સ તમને આપું છું. मेरा ग्रैंडफादर पुलकित, जो अभी 6.5 साल का है और हम डिब्रूगढ़ आसाम में रहते हैं, उसकी आंखों में जन्म से ही नंबर कमजोर है. हाँ, नजर कमजोर है. 2 फुट की दूरी से भी कोई वस्तु स्पष्ट दिखाई नहीं देती है. धूप में आंखें बंद हो जाती थी. हमने बहुत बड़े आई स्पेशलिस्ट को दिखाया, परंतु कोई फायदा नहीं हुआ. फिर बड़ौदा में दिखाया, वहाँ पे ERG टेस्ट किया, नतीजा आया CRD, कॉन रोड डिस्ट्रोफी. डॉक्टर ने बोला कि उसका कोई ट्रीटमेंट नहीं है. तब हम बहुत निराश हो गए, ऑब्वियसली. फिर मेरी लड़की अंकिता सेठिया, जो सूरत में रहती है, हमें डॉक्टर श्रीरंग व्यास होम्योपैथिक डॉक्टर के पास लेकर गई. डॉक्टर साहब ने कहा, आप विश्वास व धैर्य के साथ इलाज चालू करें, जरूर फायदा होगा. मैं अपनी तरफ से पूरी चेष्टा करूंगा. हमने ट्रीटमेंट चालू कर दिया. अभी तक 6 महीना हुआ है. पुलकित की आंखों में सुधार चालू हुआ. अब रेगुलर स्कूल जाता है. डे टाइम में स्कूल रहता है ना, तो डे टाइम में ये પેલું વાંચી પણ નહીં શકે. ઘણીવાર એનું પોતાનું લખેલું પણ એને નહીં વંચાય, તો સ્કૂલ પણ ઘણીવાર નહીં જતો. After this Lycopodium CM, he started to go to the school. अभी पढ़ने में भी मन लगने लगा है. हैंड राइटिंग अच्छा हुआ. पहला तो आपने बिकॉज આપણે જ્યારે હેન્ડ રાઇટિંગ કરતા હોય ત્યારે આપણને દેખાતું હોય કે ખરાબ લખાય છે, એટલે આપણે એને સુધારીને સારી રીતે લખીએ. He doesn't know his own, he doesn't see his own handwriting. So he ગમે તેવા કરતો હતો. But now after giving Lycopodium, he started very good handwriting. खेलने में भी बहुत एक्टिव हुआ है. यहाँ डिब्रूगढ़ में 2 साल से एक ही आई स्पेशलिस्ट को प्रत्येक माह चेकअप करवाते हैं. ત્યાં એક દર મહિને લોકો બતાવે છે. अब 6 माह के बाद डॉक्टर का कहना है कि पुलकित की आंखों में बहुत अच्छा सुधार हो रहा है. उसका जो भी ट्रीटमेंट चल रहा है उसको चालू रखना, क्योंकि हमारे पास कोई इलाज नहीं है. एलोपैथिक आपके ट्रीटमेंट के बाद चश्मा का पावर भी थोड़ा कम हुआ है. This is like genetic issue. In this type of the chondrod dystrophy, the 30 times mutation happens, then this chondrod dystrophy happens. See, multiple times of the mutation of the genes that occurs, and then the chondrod dystrophy. Right? So, चश्मा का पावर थोड़ा कम भी हुआ है, एक्सिस भी बदल रहा है. यह बहुत खुशी की बात है कि सुधार हो रहा है. समय लग सकता है, लेकिन डॉक्टर श्रीरंग व्यास का आभारी हूँ. उन्होंने हमें विश्वास दिलाया, हौसला दिलाया, आशा दिया कि बच्चा ठीक हो सकता है. इसी आशा के उम्मीद के साथ धन्यवाद. नाम से डिब्रूगढ़ से, फोन नंबर से. So we can do, we can cure, we can take, we can deal these type of the genetic issue where there is no solution, no hope in allopathic side. This is after treatment. See, the sunlight, you can easily open and you can easily see. This is in sunlight. See, you can easily see in sunlight. And this is not happened previously. Sunlight में बाहर नहीं निकल सकता. So this is the result. Still, patient is under my treatment. Lycopodium CM last આપી છે. ત્યાર પછી આપણે તે આપી નથી અત્યારે. Waiting was કે આટલું improvement છે. So let's see what happens. Right? Whether chondrod dystrophy is completely disappear, I don't know. But still, improvement ચાલુ થઈ ગઈ છે. આટલું છે. Okay? Now case number 4. Female patient, 41 years old, come with a complaint of tumor in breast. This patient is coming in our hospital OPD with hard stony sensation, movable tumor, stitching type of the pain and oozing discharge. Mammography result is there is ill-defined area of mixed ecogenousity in lower outer quadrant of right breast, bilateral benign axillary lymph node. There is also left breast. This case is initially was in the RMO of our hospital, and he has given some medicines, but the discharge is started, so she afraid, and એને પછી મને મારી પાસે સાહેબ તમે આ જરા જોઈ લેજો. Past history of same complaint of memory abscess twice, which was removed by surgery. So this is the third time memory abscess, recurrent memory abscess. Now the third time abscess appeared. The complaint started after birth of her daughter in 2014. Associated complaint, severe hair fall, back pain in lumbar region since many years. Generalities, appetite good, desire sour food, especially pickle, thirst normal, tongue moist, aversion bitter, urine 4 to 5 times in day, 2 to 3 times in night, sleep normal, dreams, there is often dreams but she cannot remember. Perspiration on face and neck. Menstrual history, 28 to 30 days cycle, 4 days, and blood is dark red, watery, and before menses there is leg pain, there is not much significant. Obstetric history, there is 2 NSCS, lower segment cesarean section, and they both are female. Okay? And there is also a history of 2 miscarriages. Past history, dengue, even 2 years ago, measles and worms in childhood. Family history, ischemic heart disease, mother hypertension, asthma, brother hypertension, sister, there is no family history, nothing is there. Thermally, she is hot. Mentally, કોલેજની ઓપીડીમાં આપણે મેન્ટલ જોવાય ને, પણ જે ઇન્ટર્ન્સ છે જે બધા કેસ લીધા એમાં એનું કીધું કે આ ટ્યુમર છે, મને કેન્સર તો નહીં થઈ જાય ને. સી ઇઝ વેરી વેરી અફ્રેડ ઓફ કેન્સર, કારણ કે એના જે રિલેટિવને આવી રીતનું એબ્સેસ થયેલું અને પછી કેન્સર થઈ ગયેલું. સો સી ઇઝ હેવિંગ ફિયર ઓફ કેન્સર એન્ડ fear of diagnosis, and she literally weeps in presence of many interns in my opinion. Obviously, this is a normal thing. So this is the medicine starting. Syrinum 1M, this syrinum nozzle is made from the CA breast. So syrinum 1M I have started as he is having fear of cancer also. And SL for 7 days, and this is the main important. Scrofularia nodosa, mother tincture, 20 drops, TDS. This is very important medicine. Right? Syrinum is okay, fine, but this is the very important medicine. Previously, that RMO has given some medicine, I don't remember, but then I started Syrinum 1M and Scrofularia nodosa. This is the first picture. The abscess is oozing and બધું નીકળે છે, discharges. The second. પણ એ healing થવા માંડ્યું છે, abscess થોડું dry થઈ ગયું છે, બધું નીકળી ગયું છે. And this is the cure of this abscess. Yes, very good. Syrinum is also having persistent cancer, bombs, hemoptysis. Right. So, this is a breast abscess. Now, what is scrofularia? Powerful medicine whenever enlarged glands are present, Hodgkin's disease, variable skin level, has a specific affinity for the breast. See, the action of the scrofularia is on the breast, specifically, right? And very useful in the dissipation of the breast tumor. What is dissipation? Dissolving. कोई भी पेशेंट आए ने साहब मारी गांठ છે ને ઓગાળવાની છે. Boericke has written the word કે ગાંઠ ઓગાળવા માટેની દવા. It is very useful in the dissipation of the breast tumor. So sometimes these simple words, if we explore these words, if we understand these words from the Boericke material, we can have very good medicines like this. Scrofular swellings, sister scan. See, nodosis is in breast, syrinum also swells. Yes, I have given mother tincture. 20 drops. Maybe potassium and other but this is an acute case. We are dealing with this abscess, memory abscess, an acute case. So I usually these type of the medicines, scrofularia nodosa and various, which are not well proved. So I usually use in mother tincture or 6 or 3x. Right? Because there is no mental symptoms are there. If it is well proved, mental symptoms are there. So in that case, we can give little bit higher also. Okay. Then after 2 to 3 months, she again comes with little bit pain and she feels that sir, પાછું આ તો થવા માંડ્યું. લાગે છે પાછું. So I had given at that time phytoleca 1M to prevent this memory abscess. So maybe hard and very sensitive tumor of the breast with enlarged axillary glands, CA breast, breast is hard, painful and of purple hue, memory abscess. So I have given preventive phytoleca 1M 1 dose, and she is coming since after phytoleca she is still coming and there is no other any painful nodules in her breast. And the other side of the breast, the tumor also went up, it dissipated because of scrofulary. Right? So follow up. First discharge, reduced but severe pain while dressing. Phytoleka bana body for 2 days. Phytoleka bana scrofular nodosa. Phytoleka bana di pada ye bano siri nam bano one was each. So ye budhi times. Second follow up, discharge stop, healing started. Ama એટલું બધું એને પેઇન થતું હતું કે એને એમ થાય છે કે મને આ પેઇન જાણે અહીંયા નહીં આખા શરીરમાં થાય છે. Symptoms like phytoleka, it's cracked nipple and painful nipple. The pain goes to the entire body. So at that time I think of phytoleka, and પછી એને preventive માટે મેં પછી phytoleka consider. Third follow, calendula 30 bundles to just to increase the healing of the abscess. And fourth follow, I said maybe for 7 days everything is went off. There is no another nodules also. Regarding diagnosis or regarding treatment, anything? क्या हो रहा है? सर, thank you. Next question. Yes. So a case of 43-year-old female. Case of 43-year-old female complaining of bleeding piles with constipation from many years. Okay. She is a known case of diabetes also, obesity also, and she is complaining of having uric acid diastasis, and that is gout. Weight is 98 kg, uric acid is 8.3, and HbA1c is 7.5. Stool very hard, can only pass with great strain. बहुत जोर करूँ पड़े त्यारे निकले, and sometimes it receive bags, and blood is bright red. Both legs, she is having cramp, especially at the night, and it is aggravated by stretching leg. Back pain in lumbar region from the many years, which is aggravated on lying on back and bending backward. These symptoms of finger, there is numbness and stiffness after writing. She is a very well-known head of the department of one of the college in Surat, in English department, and she is a very good poet and very good writer. She is also a counselor and motivator in Surat. She is well known. Toes stiffness, which is aggravating long after, and this is very important symptoms I have come across in the second follow, not the first follow. Yawning aggravated breakfast after. Whenever she goes for a lecture in her college, she usually does not do breakfast, because after having breakfast she yawns much, and there is a disturbance in giving lecture. So એને બહુ જ બગાસ આવે એટલે lecture નહીં આપી શકે. So this is simply એને એકદમ casual way માં લીધું, પણ I took these symptoms. She yawning before breakfast. Stomach, acidity, sour irritation, heartburn, very common. Weakness, which is aggravated after sleep, waking after sleep. The સવારનું ઉઠે બહુ જ weak હોય. Menstrual history, very scanty. She is at the menopausal age, so very irregular, 6 to 3 years. Sometimes it comes twice in a month, and sometimes it comes once in a month or 3 months. It appears only for 2 to 3 days and 15 to 60 days cycle. So either it comes every 15 days, or it may delay up to the 60 days. So she is having menopause with flushes of heat. Physical general, appetite not much good. Thirst is excessive thirst. Tongue is mild coated. Desire spicy. Aversion not specific. Disagree spices. It causes acidity. Stool constipated. Urine 6 to 7 times a day, night 2 to 3 times. Sleep. Cramps in leg during sleep. She has to get up from the sleep. Sleep position on the side. Occasionally talks in sleep, sometimes unrefreshing. She is having dreams of quarrels, and that continues on the next night. So continuous dream. Past history of urticaria. Obstetric history, 2 LSCS, 1 abortion. Family history, father is having diabetes mellitus, hypertension, mother diabetes, hypertension, grandmother myocardial ischemia, osteoarthritis, rheumatism, sister is having also diabetes and obesity, brother is having gout. Mental history. As I told you, she is working professor in well-known college of Surat. She is very censorious, takes everything negative, very, very loquacious. She is having jealousy to the senior colleagues. And whenever she is having some confrontation with colleague, she goes into the garden of her college and then she walks for some time and she feels better. So sadness better by going in open air. Very, very sensitive, and husband is very dominating. Sympathetic, cries on suffering from other. She is a Desai, so એના ગામમાંથી બધા આવે રિલેટિવ્સ તો એ લોકોને કંઈક તકલીફ હોય તો એ હોસ્પિટલ લઈ જાય, એને ટિફિન પહોંચાડે, એને ઘરે રાખે. So in a way she is very sympathetic, helping, very caring also. Ever ready to help relatives. And she is having anxiety for others. Hobbies, writing, giving motivational lecture and counseling. So I take rubric mind, sadness, air open, emerald. Mind, dreams, quarrel, strife. Mind, loquacity. Mind, censorious, critical. Mind, sympathetic, compassionate, too. Generalities, heat, flushes of, and sleep, yawning, morning, breakfast, after. Another rubrics. Generalities, climatic period aggravation, female, menses scanty, back pain, lumbar region, lumbago, extremity, coldness, chilliness, finger tips, writing after. She is a writer. પણ એ બહુ ઘણી વખત લખવાનું વધારે લખે એટલે એના આંકડાઓ નંબર થઈ જાય, ઝંઝણી આવી જાય, ઠંડા થઈ જાય. Extremity numbness, insensibility, fingers, writing aggravate. Extremity cramps, leg, calves, night. And extremity cramps, leg, calves, stretching leg aggravate. So these are the rubrics I have taken. And this is the repertoire chart. This is the medicine. The first medicine, which is that Carl's bath. It's made from the mineral water, spring water. So it contains many, many minerals in it. So it's very, very useful. આપણે જોઈએ છે કેવું છે તે. Carl's bath. બોરિકની અંદર જે લખ્યું છે, famous for its action on liver and the treatment of obesity, diabetes and gout. Finish. First 3 indications. This is a very good combination of many, many patients. તમે બધા જ પેશન્ટ જો ડાયાબિટીસ છે, ઓબેસિટી છે, ગાઉટ છે. This is a very common combination of this is comorbidities, right? So in homeopathy but useful in weakness of organ, constipation, great liability to take cold, periodicity, flashes of heat all over. So on this base, I confirm after repetition Carl's bath and given Carl's bath, 30 BD.
If you go in this rectal symptoms.
Yes.
The constipation, stool receipt that.
Yes.
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 That has been
And bleeding piles also later. Bleeding piles. Right? So even yes.
Very low pressure, highlight is hemoglobin.
Yeah, बताओ. Carlsbad, CRN. Yes. Feces held back, stool slow and only passes by much abdominal pressure. Burning in rectum and anus, bleeding piles. So everything is covered by Carlsbad, right? Yes, domestic affair. Yes. And she is having this anxiety of her families. કે એના બધા ત્યાંથી આવે રિલેટિવ્સ એને માટે એટલું બધું કરે એટલે we have to took this to be anxiety others for, right? Yes, discourage and anxious about domestic duties. Very good medicine. So બોરિક ની અંદર આ સ્પેશિયાલિટી કે નાની મેડિસિન્સ છે એની અંદર કોમોર્બિડિટી ની એટલા મસ્ત કોમ્બિનેશન આપ્યા છે. એ ખાલી તમે જોઈ લો ને you can prescribe. So these are the lesser known and lesser used medicine. And today's my motto of giving this discussion is just to know what are the lesser known and lesser used medicine in the practice, right? So Carlsbad 30 BD for 3 days, SM BD for 15 days. First follow-up, better in constipation, bleeding reduced, backache increased. Second follow-up, cramps almost relief, menses appear after 2 months, normal flow. Carlsbad 200, I have repeated, 1 dose, SL for 15 days. On the third follow-up, there is no bleeding, no backache, numbness of the finger is also ameliorated, stiffness of the toe much better. Uric acid, મારે આ રિપોર્ટ મેં આ ટેલિફોનિક ફોલોઅપ લીધેલો હતો અને એને મોકલી આપેલી હતી દવા એને કારણ કે એ પછી અમેરિકા એના સન પાસે ગયા હતા એટલે આ યુરિક એસિડનો રિપોર્ટ કરાયો નથી. HbA1c નો પણ રિપોર્ટ નથી એની પાસે એટલે લાવ્યા નહીં હતા. So no change in weight and fourth follow-up, she complains of hypoglycemia twice in a month. So this medicine is acting on diabetes. It produces hypoglycemia. Are you with me? So this is the thing. Unfortunately, I report મારી પાસે અત્યારે નથી આવ્યા કે અમેરિકા જતી રહી ને પછી એને બહુ ધમાલમાંથી એટલે મેં મંગાવ્યા નથી. So this is a Carlsbad, very important medicine. Obesity, diabetes and gout with renal piles, constipation. Case number 6. Yes. A female aged 42 came with a complaint of temporal headache since 1 month. Headache is always associated with nausea and dimness of the vision. Occasionally she vomits with state sour and is watery. This vomiting is ameliorated the headache. Migraine, she must lie down and sleep to get relief. Headache after nausea and vomiting. Whenever she avoid hunger due to the work or exertion, she usually gets this migraine headache, migraine headache. Salivation excessive and sticky. Headache has been on and off since many years, but from a month it has been continuous. So she suffers a lot since 1 month. She came to me, and on further history, we got to know that she was busy in shopping for her daughter's wedding. એની દીકરી લંડનથી આવેલી હતી અને એના મેરેજ હતા અને એના મેરેજ એ 1 મહિના માટે જ આવેલી હતી. મેરેજમાં એને બધું આ મેનેજ કરવાનું હતું, શોપિંગ કરવાનું હતું, દોડાદોડી હતી, બહુ જ એક્સર્શન હતું. દીકરી એકદમ લાડકી હતી એટલે નાની વાતમાં ખોટું લાગી જાય એટલે એને બહુ જ સાચવવી પડતી. This all are giving stress to our patient. So it's a mental exertion, right? And which was creating a lots of stress on her. I had given this medicine, epiphagus, a very important medicines. See, follow up after 3 days. Follow up, see is much better, no headache, no vomiting. Still stopping is continued, still marriage is not get done, right? So, indication of the medicine. Remedy for sick, neurasthenic and nervous headache, especially in women, brought on or made worse by exertion and sopping. See the word sopping. આપણે કશે જવું નહીં પડે. બોરિક સાહેબ બધું લખી દીધું છે. Exactly. So, female homeopaths બધા એપિપેગસ લઈ રાખવાની જેથી તમને શોપિંગ કરતી વખતે હેડેક નહીં થાય. બરાબર છે? મેલમાં tongue coated yellow medicated drowsy after meal. Sub-involution with painful menstruation and congestion. Okay. So, sick headache coming on when deviating from ordinary pursuit. This is very important. This is deviation from routine life, having mental exertion. Headache from now tired caused by mental or physical exhaustion. Preceded by hunger. Shopping જાઓ એટલે shopping માં એટલું બધું હોય કે ખાવાનું ભૂલી જવાય. Right? Especially female માં મેલ ને તો આજુબાજુમાં કશે કંઈક લારી પર જઈ આવે પણ ફિમેલ જે લોકો લેતા હોય એ લોકો તો ભૂખા જ હોય. Right? So preceded by hunger. So from these things I had given her epiphagus and within 3 days almost no headache. પછી એના એ લેડીના હસબન્ડનો ફોન આવ્યો કે સાહેબ તમે આવી દવા આપો મારો ખર્ચા વધતા રહી છે. કેસ નંબર 7. એ હવે તો પછી આપીએ ને આપણે. હમણાં તો આવવાની ના પાડી દીધી ખર્ચો વધી ગયો એટલે. Male child, so this is very important, beautiful case. A male child, aged 6 to 7 years old, had a complaint of sleeplessness from last 9 months. Sleeplessness in child. Stomach, indigestion and frequent diarrhea off and on. Diarrhea off and on, that is indigestion. Mentally, the child is very, very irritable during the whole day and difficulty in studies due to lack of concentration. He becomes nervous before examination, very restless and having palpitations. See, first કે second standard માં ભણે છે એ 7 વર્ષ કેવું કહે છે. Restless and having palpitation. He is timid and fearful. He has fear of failure in exam. Nowadays અત્યારે તો જુનિયર ને સિનિયર કેજી માં પણ ટ્યુશન્સ હોય છે. બરાબર છે. નર્સરીમાં પણ ટ્યુશન મૂકે છે. આ ફર્સ્ટ સેકન્ડ સ્ટાન્ડર્ડનો સ્ટુડન્ટ છે. So fear of failure in exam, started eating less from a month before exam. Exam ના આવે એટલે મહિનાથી બધું ખાવા પીવાનું બધું ઓછું કરી નાખે. Appetite not much, thirsty, very dry mouth, especially before the exam. See, these are all the symptoms of nervousness, isn't it? Desire for chocolate and cold milk, tongue mildly coated, aversion to sweet, stool, frequent diarrhea, urine 5 to 6 times a day, perspiration normal, sleeplessness, startles in sleep. Suddenly he startles, suddenly wake up and cries after waking, and after waking he plays his mobile and he occasionally laughs and there is he feels unrefreshed in the morning, right? So એ રાત્રે ઊંઘમાંથી ઉઠી જાય, રડતો રડતો ઉઠી જાય, પછી એને ઊંઘ આવે નહીં, રમ્યા કરે, રમતા પછી હસે, બોલે, મોબાઈલ પર જોયા કરે. Even he laughs in sleep also. Dreams occasionally of friends, ghost and white unicorn. White unicorn, ghost આવે છે. મોબાઈલ બહુ જોઈએ એટલે આ મને વ્હાઇટ યુનિકોર્ન શું હતું ખબર નથી, પછી મેં એને પૂછ્યું એટલે એને કીધું પાસ હિસ્ટ્રી, દેર ઇઝ ડિફિકલ્ટ ડાયટિશન, મને બધી બહુ પછી દવાઓ આપેલી, ડાયરિયા અને એલોપેથિક બધી દવાઓ પણ આપી લીધી. દેર ઇઝ રિકરન્ટ ડાયરિયા. ફેમિલી હિસ્ટ્રી, એસિડ પેપ્ટિક ડિઝીઝ, ગ્રાન્ડફાધર ડાયાબિટીસ, ગ્રાન્ડમધર ડિપ્રેશન, અંકલ ડિપ્રેશન. See now the life situation. He is the only child. એના બે કાકાને પણ કોઈ છોકરાઓ નહીં. So obviously this is a pampered child. બહુ લાડકો, right? Has a habit of spending 5 to 6 years in the mobile as a day, in a day. બરાબર છે? બધા પપ્પા નહીં આપે તો કાકા પાસે લઈ લે, મમ્મી નહીં આપે તો કાકી પાસે લઈ લે, મોબાઈલ લઈને બસ રમવા. This is the normal scenario of the older child. Cyclopedium. I have prescribed cyclopedium. The skin symptoms correspond to the question of the last. Nervousness in the children from teething and intestinal trouble. Nervousness in children from teething and intestinal trouble. He is having intestinal trouble since long. Sleeplessness, cerebral hyperesthesia in young children, often the result of overstimulation of the brain. This is very important sentence. Sleeplessness, cerebral hyperesthesia in young children, often the result of overstimulation of the brain. Now, મેં પહેલી વાર વાંચી ને ત્યારે મને બહુ ખ્યાલ નહીં આવ્યો કે વોટ ઇઝ cerebral hyperesthesia, overstimulation of brain. Now, rubric. Laughing in sleep. Laughing sleep during. Cyclopedium is there. Cyclopedium. Cyclopedium. Right? Playing and laughing child with sleeplessness. Cyclopedium. Only single medicine. Indigestion. Mental exertion of cyclopedium. So I had given cyclopedium 200 TDS for 2 days and SL for 15 days. First follow up, જે રોજ જ ઉઠી અને રાત્રે 2-3 કલાક એવી રીતે રમવામાં કાઢતો હતો. આફ્ટર ફર્સ્ટ ફોલો 15 દિવસમાં ખાલી 2 કે 3 વાર સ્લીપલેસ થયો. અધરવાઇઝ 10 to 12 days he is having very good sleep. Second follow up, better sleeplessness last only for 1 hour. જ્યારે પણ એ સ્લીપલેસ થાય છે ત્યારે ફક્ત કલાક એક માટે જ ઊંઘ ઉડી જાય ફરી પાછો. So the intensity and duration is less. And from the third follow, એ મેં ડેટ નથી લખી બધી, પણ લગભગ 3 મહિનામાં આ સ્લીપલેસનેસ એની ક્લિયર થઈ. The thing is, the cerebral hyperesthesia in young children after the result of overstimulation of brain. This is what I want to understand and want to share my experience. What is this? Right? So I have find some books on the neurology also. I have asked many neurologists, my friend, and what is and how this overstimulation of the brain affects, right? So some of the symptoms, what book says and what my friend neurologist says, that the overstimulation of the brain is due to the sensory overload to the brain. And what is sensory overload? How it comes? It comes from all the informations from the five senses that goes into the brain. So mobile ma tame vacho, social media ma, digital media, TV, this all the exposure to this media gives you excessive information in the brain. Even આપણે કોમ્પ્યુટરમાં પણ જો બહુ એક્સ્ટ્રા બધું ફીડ કરીએ તો એ હેંગ થઈ જાય, ફૂલ થઈ જાય એની મેમરી. Here the brain is having daily overstimulated by all this information. Daily કંઈક ને કંઈક નવું આવે. Even in medical field, even in social media, even કોઈ પણ લોઝમાં કે ભાઈ કાલથી હેલ્મેટ ચાલુ થવાની છે, કમ્પલસરી છે, હર સંઘવીએ કીધું છે કાલથી. This type of information, and that is circulating in all the medias, right? છોકરાઓ શું જોઈએ? છોકરાઓ બધા ગેમ્સ જોઈએ, ગેમ્સ રમે, right? Overstimulation. This information gives rise to the nervousness symptoms. And the common side of this hyperstimulation from the over information in the brain give rise to the trouble sleeping. Trouble sleeping. He is having sleeplessness. It impairs the cognitive function like memory and concentration. He is having fear in appearing exam. Are you with me? He is having fear of failure because this over information, over stimulation of brain affects his memory. And he is having fear of failure. Right? Sensory overload causes restlessness, fidgety, all these nervous systems, emotional and physical discomfort. See? Panic, impending danger. So these are the symptoms that causes. The cause is overstimulation of them. In even adults also, sensory overload causes lack of concentration, anxiety, with palpitation, with sweating and trembling, right? Sadness, irritability. Again, the nervousness symptoms in the child, like decreased appetite, unappetite nothing, exam જેવું આવે તેવું થઈ જાય, not eating properly, fear of impending danger, breathing rapidly, sweating, trembling and difficulty in concentration. Boericke has given only the two sentences, right? Cerebral hyperesthesia, especially in young children, due to the sensory overload. But these sentences we have to understand and probe that what it causes, right? Like nervousness children તો આપણે ઘણા બધા જોવા મળે. We prescribe many other medicines also, indicated medicine. Sometimes we cannot get result. So તમને પણ કોઈક આવા એક્સપિરિયન્સ થાય સાયકોપેડિયાનો તો પ્લીઝ શેર વિથ મી. મેં લગભગ 5-7 કેસની અંદર મને સારા રિઝલ્ટ મળ્યા છે. સો પ્લીઝ કોઈક તમને પણ થાય તો મને શેર કરજો, વેધર વી આર રાઈટ ઓર wrong in this type of the understanding. So બોરિકની આ જ ખૂબી છે. એ નાના સેન્ટેન્સમાં ઘણું બધું કહી દે છે, પણ નાનું સેન્ટેન્સ આપણે અન્ડરસ્ટેન્ડ કરવું, પ્રોબિંગ કરવું પડે. લાઈક આપણે સ્કોર્ફિડ અને નોઝોલાની જોયું કે એને લીધું કે ઇટ ડિસિપેશન ઓફ ધી memory tumor. So what is dissipation? That we have to understand. Right? Memory tumor, but how it works. So this, some words and sentence give you a very good information, and that is all given in Boericke Repertory. So this is one of the case I really like to share with you is this. So case number 8. one important symptoms I always give tips to my final year student ke bhai excessive sleepiness before examination. Sleepiness before examination. ઘણી વાર એમ કે હવે બહુ બધું યાર વાંચવાનું છે, બહુ ઊંઘ આવે, કઈ થતું નથી. It is usually happens before examination. Sleeplessness nahi, sleepiness. Sleepiness. For that, scrofularea nodosa, mother tincture is very, very important. You can prescribe in your colleague or student. Very important. It makes you aware, awake, and you can read. Right? So opposite symptoms. So patient around 83 years old from Surat comes with the complaint of difficulty in starting urination. He has to give pressure to start urination. बहुत जोर करવું પડે તો જ flow start થાય. And there is a constant urging for urination. Great straining, intermittency with poor stream. Urination more frequent at night. He was diagnosed as a patient of આમાં ડાયગ્નોસિસમાં ઘણીવાર બહુ સિમ્પલ એ લોકો વસ્તુ કહેતા હતા. He was diagnosed as a lower urinary tract symptoms. This is the diagnosis from the urologist. મારી પાસે એક એવું હતું કે પેશન્ટને ખંજવાળ આવે ને એ નોડ્યુલ હતા. ડર્મેટોલોજીસ્ટ પાસે ડાયગ્નોસિસ માંગ્યું, એણે ડાયગ્નોસિસ કર્યું પ્રુરિગો નોડ્યુલારિસ. અરે ભાઈ એ તો અમને બી ખબર છે. Prurigo, pruritis, and nodularis. Prurigo nodularis. Right? So, sometimes આવા diagnosis હોય આપણે એના કરતા આપણે સીધું symptomatology કરીએ, આપણે prescribe કરીએ શું વાંધો છે. Right? Okay. So, symptoms with mild prostatic enlargement, bladder muscle weakness is, that is the detrusor muscle is not properly contracted to excrete urine. So muscular weakness. Associated complaint, irritations and flatus. Very often GERD છે, gastroesophageal reflux disease, having reflux, especially at night with indigestion. Occasional sour vomiting. Also he has right inguinal hernia and cholecystitis. Appetite not much, thirstness, yellow coated tongue, stool is desire sweet, stool constipated, urine 6 to 7 times a day, and night 5 to 6 times. So એને બહુ ઊંઘ જ નહીં આવે કારણ કે 5-6 વાર એને ઉઠવું પડે because of prostate and lower urinary tract syndrome. Perspiration in general, especially at night. Past history of malaria, fungal infection of the nails and ringworm. Family history not much significant, and brother is having CA prostate. Mentally, mental side, he is a retired freedom fighter. He is basically a Kashmiri Pandit and freedom fighter, right? And he is a father-in-law of one of the professor in our city, Bachigar College, right? So he is retired freedom fighter. Now settled in Surat. By nature he is very helpful and sympathetic to others. Very, very helpful. He is also associated with many NGOs like Vishwa Hindu Parishad, then Adivasi Kalyan Yojana. ઘણી બધી NGOs ની અંદર he is associated and very active. અને આ ઇન્સ્ટિટ્યૂટ ની અંદર કંઈ પણ કંઈ ગરબડ થતી હોય ને તો he was the first to oppose and correct all these things. Even he was in the association of the armies. He is a retired army man in Kashmir. And ત્યાંના retired army ના association માં પણ he is very active. અને એમાં કંઈ પણ જો કંઈ injustice કે એવું થાય તો he is always ready to fight. This is the history. So he is worried for his son who is not properly settled at the age of even 35. He is associated with various energy or tools. So rubric I have taken mind sympathetic compensator 2. Yes, somebody murmurs the medicine. Yes, mind anxiety others for. Mind anxiety family about his mouth coated yellow tongue. Generalities food and drink sweet desire. Bladder urination retarded must wait for urine to start. Bladder urging to urinate, morbid desire, urination scanty with. Bladder urging to urinate, morbid desire, frequent at night. So these are the rubrics I have taken. And absolutely right, somebody says it is causticum. Very good. Very simple case, na? Huh? Fine. So causticum, I had given causticum. Sorry, causticum I have given. Pulsatilla but I have not given pulsatilla because he is anarchist. He is anarchist. Causticum is the medicine. Anarchist. Always ક્યાંય પણ કોઈ ખોટું નહીં ચલાવી લે. કોઈ પણ એસોસિએશનમાં તરત જ એ ઝંડો લઈને ઊભો થઈ જાય. Freedom fighters. Revolutionary. So anarchist I have taken and then I have prescribed this causticum. So pulsatilla પણ લાગતી હતી પણ પછી આ જોતા મેં રૂલ આઉટ કરી નાખ્યું. So causticum 200, 1M, 10M. All patencies were given but no improvement. Now what to do? Patient is still having overflow and occasionally involuntary urination when not attending. After reconsidering case, taking only physical symptoms. Now, see, आपे 6 મહિના 8 મહિના આપ્યા પેશન્ટ આવે ને સાહેબ કઈ ફેર પડતો નથી શું કરીએ રાઈટ અને પેલા અમારા કલીગે મોકલેલો એટલે આપણે ઇમ્પ્રેશનનો સવાલ રાઈટ સારું નથી થતું યાર એ આપણને સર કે સર જરા જોજો કે સર સારું એટલે આપણને ઇમ્પ્રેશન ખરાબ પડે કે આમાં કંઈ બહુ લેવા નથી સાહેબના એવું થઈ જાય રાઈટ સો I reconsider a case and taking only physical symptoms. See, now sometimes ઘણી બધી વાર આવું થાય કે આપણે કોન્સ્ટિટ્યુશનલી આપીએ મેન્ટલ સિમ્ટમ્સ પર આપીએ બધું જ બરાબર હોય but still the medicine is not acting, either not acting or there is no relief. Okay? So at that time what we have to do is considering characteristic symptoms and concomitant symptoms, and after that I have given her him Populus T. Populus tremulus. TDS for 3 days. There are two medicine, Populus can and Populus T. Populus can is given in the instantaneous voice producer. So it's very good medicine for singer and an even speaker. मैं आज सवार मारू गड़ो बिस्कुट लेने आई just kidding
web sensation improve.
Yes. Right? So I had given Populus tribulus TDS for 3 days, SL TDS for 15 days. Follow better in physical complaint, better in indigestion and cystitis also. He is very very improved by this Populus T. And what Boericke says, the gastric and urinary symptoms, a combination, gastric and urinary symptoms. See, he is having GERD, indigestion, sour vomiting, acidity, usefulness in dyspepsia and catarrh of the bladder, especially in old people. Are you with me? Very good remedy for vesical troubles after operation and in pregnancy. Cystitis, prostatic enlargement with cystitis. So many a time we prescribe constitutional well-known polyclast medicine, but if it not acts properly, if it is does not give desired result, we should think of this type of these small medicines which has specific action on that particular organ or disease. So
this one line is very important. I used this remedy almost more than 30-40 cases in a female after the surgery. After any pelvic surgery, there are a lot of cystitis problem, a lot of involuntary urination problem that comes, retention of urine comes. It's very important for vascular troubles after operation, even in the pregnancy. I use a lot in female cases.
So Boericke has given so much small medicine which is having very good action. Yeah. Yeah, we can give Medorium, yes, Medorium, but still patient is having, no, I have not given Medorium, but because causticum is so well indicated.
No, it is not like that.
Yes, don't, yes.
Is it
No, but I have not considered here in any antimiasmatic, but still, yeah.
Antimiasmatic in such cases, the myasum is already blocked. The myasum is blocked. Why? This is called as a localized. We are treating the locals first. Locals will remove the myasum and the pre-existing myasum or existing myasum will work. So here if you will prescribe on the myasum level, may or may not be work. Both the things are possible. Because it is an obstruction. The pathologies are always indicating on local side. That is your obstructive part. You have to cure that particular part, then myasum works as a whole. We have already given on that particular holistic approach, but it doesn't work. So this is the localization is very important. Boericke is also sometimes helpful to remove such local complaints, and then your myasum remedy starts.
And see, this nature will not be changed after causticum. It's a disposition of this patient. So we cannot change, and we cannot depend, and we cannot give and depend on this constitutional medicine. So we have to give some comfort, relief to the patient. See, in my experience, 90% of the patient does not want ideal cure. Mind me. Does not want ideal cure. Yes.
Not a single organ with that cure.
Right?
Cure is a very vague term.
Yes. They want only relief. Right? So, in this particular case,
disease.
Yeah.
From one place to another place. That's it.
So in this particular case, I have not considered antimiasmatic. I must, but I have not considered because causticum. When I have to consider miasmatic, when I fail, and I am not sure about the medicines, particular similarly one, then I sometimes give antimiasmatic medicine.
Look at the causticum. They always cover the miasm.
It's a psychotic medicine. It is well-known psychotic medicine, right?
That means your remedy was not correct. What it did, reconsider a case, it took the physical symptoms and prescribed remedy, which was the correct one indicated for at that particular time. Therefore, we have to do.
Okay. So, and the patient and my colleague were so much happy. Even she is a homeopath, but she does not want to. She does not want an ideal cure. Okay, इतना हो गया ना बहुत हो गया. Each and every patient, 90% needs only the relief. Relief आपको साરું लागશે. I am not against ideal cure. And I am not against of the ideal cure. but ideal is very, very ideal to reach. Right? Yes, yes. Okay. આપણે પેલું સ્ટફી કોલ્ડ નો કેસ જોયો ને શરૂઆતમાં એકદમ સ્ટફી કોલ્ડ કે ભાઈ તમે આ બધું સપ્રેસ નહીં કરતા, શરદી સુખાવી નહીં કરતા, તમે મને બહાર કાઢો, બધું નીકળી જાય. આ એક્ઝેક્ટલી ઓપોઝિટ કેસ. 47-year-old male patient comes to me with the complaint of excessive watery coryza from last 15 days, and he had excessive dripping of the water with sneezing and frontal headache. Associated complaint is sleeplessness since long time in પહેલેથી છે. ઓફન એન્ડ કોલ્ડ થયા કરે અને જ્યારે પણ થાય ત્યારે એટલું બધું ડિસ્ચાર્જ નીકળે, એક્સેસિવ મ્યુકસ ડિસ્ચાર્જ. Patient is very weak after having valvular heart surgery before 15 years. And appetite is reduced, thirst normal, tongue normal, desire not specific. He is having addiction of alcohol, daily 1 to 2 pack, so he is alcoholic. Stool occasionally constipated, urine frequently at night, dreams not specific. स्लाइड थोड़ी आप आगे बढ़ सकते हैं. So urine frequently at night, dreams not specific, sexually very hyperactive even at the age of 47, having masturbation on and off, and there is emission at night during sleep. He is a married man. In spite of marriage also he is having masturbation. Past history, sleeplessness up to 1 a.m. Then he goes to sleep and again he wakes up at the early morning 5 a.m. and then so only 4-5 hours of the sleep is there. Rheumatic fever in the past and had penicillin injections. Fracture of lower endometrium. Family history not much. Father diabetes, mother hypertension. And this is a case. This is a video. See the speed of discharge. See the discharge, excessive discharge. And this is throughout the day. 4 દિવસ. Sometimes આ પેશન્ટને આપણે સંભાળવા બહુ અઘરા પડી જાય. તમે ગમે ના મફત સાહેબ વિકોરિલ લઈ લેશ, એનાથી સુકાઈ જાય. આપણે તો કે ભાઈ વિકોરિલ તો લેવાય જ નહીં, સપ્રેશન થાય. But patient want relief. Even આપણને પણ જો excessive coryza, suppose મને આજે સવારે થયું અને મારે એ લેક્ચર આપવાનો હોય, what I have to do? I have to suppress. So everybody has some activities. અને એની અંદર આ ડિસ્ટર્બ નહીં થવું જોઈએ. Right? So this is it. બે ત્રણ દિવસના બધા વિડીયો મોકલ્યા હતા. Excessive water release. This is after medicine. નામ બધા કે ઘણું સારું છે. હવે This is the medicine. Avena sativa Q20 drops TDS for 7 days. 7 days. Right? Coryza of phenol. Right? Follow much better within 2 days, but I have continued the medicines. Much energetic. Sleep improves after years of sleeplessness. Sleepy too. Now see the materia medica of the Avena sativa. Has a selective action on the brain and nervous system, favorably influences the nutritive function, nervous exhaustion, sexual debilities. And the morphine habit calls for this remedy in the other material doses. Best tonic for debility after exhausting disease. Now tremors of the aged, chorea, paralysis agitans, especially post-diphtheritic paralysis, rheumatism of heart. He is having valvular heart disease, right? Cold. This is very important symptoms. Sentence. Colds, acute coryza, 20 drop doses in hot water hourly for few doses. Boericke છે કે તમે few doses આપો, કલાકે 20 drops, it relieves. Homeopathic antihistaminic. Yes? Right? You know, alcoholism. See, patient is non-alcoholic. Daily 1 to 2 peg. Sleeplessness, especially of the alcoholics. I have not given any medicine in potency. Only prescription is mother teacher. Even a sativa. Nothing else. Bad effect of morphine habit, nervous state of the many female tumors. So this is a case of Avina sativa. Okay. Now exam. Guess the remedy. This remedy is very, very antiseptic. It acts as an expectorant also. It is diaphoretic, means it induces the perspiration and it relieves the temperature, fever. Dyspepsia, very good medicine for dyspepsia. See the fever, it acts on the malaria also, it acts on the influenza also, it acts on typhoid also. Many times we came across with this, કઈ diagnosis થતું નથી, પહેલા pediatrician મેલેરિયાની દવા આપી, પછી પહેલા વાયરલ કીધું, પછી કીધું કે મેલેરિયા કરાવો, મેલેરિયાની ટ્રીટમેન્ટ આપીએ, મેલેરિયાનો રિપોર્ટ નેગેટિવ આવ્યો, કઈ નથી, અને પછી હવે ટાઇફોઇડ. પણ એ પણ એટલે બધું મેડિસિન આપી દે, ડોક્ટર એમ કહે છે કે રિપોર્ટમાં તો આવ્યું નહીં ટાઇફોઇડ, પણ લાગે છે તો આવું જ. This is usually happens, isn't it? Okay. So this, carcinosis. Diuretics. It acts as a diuretics. See, any action to जो आ બધા words, clinical terms has been written in the medicine. Duodenal ulcer. अमित भाई ने બધું ખબર પડી જાય છે. Duodenal ulcer. Malignancy of the stomach. Sore throat. Now upper respiratory tract. UITS. See, sore throat, pharyngitis, laryngitis, sinusitis, frontal and ethmoidal. આ બધી ક્લિનિકલ ટર્મ મેડિસિનમાં લખી છે, એ મેં કોઈ ગોઠવી નથી, રાઈટ? Acute diarrhea, typhoid diarrhea, dysentery, see on the GI tract, the action of the medicine. Acute nephritis, pyelonephritis, kidney, બાકી શું રહ્યું બધા, right? Okay, urethral stricture. Now lower respiratory tract symptoms, asthma, bronchitis, whooping cough, emphysema. Okay, right? Which one? Pyros and not tyrosin. Lobelia, not lobelia.
Eucalyptus.
It is eucalyptus. Very good. Very good. Congratulations. See, eucalyptus. Eucalyptus, you go through the body. Each and every clinical condition has been written. Am I informed? Eucalyptus globulus. Very important medicines. Even there are relapsing fevers. હમણાં ઘણા બધા એવા સાહેબ તાવ ઉતરતો જ નથી, કંઈક આવે ને કોઈ આના ડાયગ્નોસિસ કે ના પેરાસિટામોલ કે ડોલો કે એવું તો આપવું જ પડે તો જ તાવ ઉતરે છે. રિલેપ્સિંગ ફીવર, રિલેપ્સિંગ ઇન્ફ્લુએન્ઝા, very important medicines. બધું જ કવર કરે તમે જુઓ, રાઈટ? ફ્રોમ હેડ ટુ ફૂટ બધું જ કવર કરે છે. Very important. I have extensively used eucalyptus in nowadays the scenario of the fever. Recurrent fever આવ્યા જ કરે. Even Dr Smir Sarkar has suggested this eucalyptus mother tincture for the gargles in the tonsillitis. Yes, and peritonitis. He has given combination of eucalyptus Q and phytodenca Q in the warm water. You can gargle and give. So it is externally is very useful also. Right? Which one? Mother, even if mother tincture is not available, you can give 6. I usually give in 6 potency, 6 potency. Now another. It's a powerful immunogogue. Means it clears out the uterus. Reflex condition from the disturbed uterus and pregnancy. So all the symptoms from the uterus or either during pregnancy. Menses is suppressed. Tardy menses, scanty menses. सब मेंसेस નથી આવતું એટલે બધું એવું શરીર ભારે ભારે થઈ જાય, વજન આવે, વજન વધી ગયું છે, હસબન્ડ કહે કે તું ચાલવા જા, દોડવા જા, મેન્સીસ જ નથી આવતું, શું કરું? Retained placenta after delivery, if there is a retained placenta, uterine fibroid and uterine sub-involution. Whenever there is after delivery, the size of the uterus cannot become normal, that is called sub-involution. So it is also indicated in this. Any guess? Gossypium. Very important medicine. Gossypium. But the main symptoms is the flow is about to start and does not do so. Some period આવવા જેવું લાગે છે પણ આવતું નથી. As if menses would appear but does not. This is the most important symptoms of the gossypium. Here one thing is there, બધા કપાસિયાનું તેલ વાપરતા હોય, ઘણા બધા. But sometimes this cottonseed oil causes having some gossypol toxins. And this gossypol toxin is well known to induce infertility and reduce sperm count and reduce motility. This is very important. Right? So sometimes અત્યારે પેલો ટ્રેન્ડ છે કે ભાઈ unfiltered oil વાપરવાનું, organic oil વાપરવાનું, right? એ ટ્રેન્ડ છે. Unfiltered oil ની અંદર ઘણીવાર ગોસિપોલ ટોક્સિન્સ આવી જાય છે અંદર, and that causes infertility in female, and that causes low sperm count in male and low motility. So I usually advise in my infertility patient, please stop to eat cottonseed oil, that is kapasyan oil. I usually advise them. Right? So it is written in
Sir, does it induce abortion?
I have initially used this medicine Gossypium Q and Cantharis Q combination to induce abortion, but for the initial months only. અને પછી બહુ રિઝલ્ટ નથી મળતા, સેકન્ડ થર્ડ મંથ પછી નથી મળતા, પણ in the first months we can get result to induce abortions. Gossypium Q and alternate with Cantharis Q. This is few cases of college OPD. Clear thava madam? Right side, left side. First one. This is the clear. Very simple medicine. આની અંદર આપેલી છે આપણે. But why I show you these cases is importance of intercurrent medicine. This patient comes in my college OPD and he had so many visit to the dermatologist. He applied so many creams. He took so many antibiotics and all these things, right? Right? And after that he came to me, and I had given only sulf-iodide. Sulf-iodide. Obstinate skin affection, obstinate acne, right? But the thing is, that after that he relieves. But after sometimes, 2-3 મહિના પછી એ ફરી પાછો આવ્યો અને પાછા થઈ ગયા. Now what to do? Sulfur-iodide is not acting, right? So here I have used one intercurrent medicine, and that is tetracycline. Tetracycline 200. Okay, intercurrent medicine. And after that, the last આપણે આ જોઈએ છે.
So one thing I just want to tell you, if you look at the acne cases, the dermatologist prescribes doxycycline or the tetracycline.
Yes.
Extensive. Such type of cases.
6 TDS for 2 days, 3 days only. And then wait and watch. So this is the importance of intercurrent medicine. First this is a eczema, psoriasis eczema on the palm, and after giving medicine, this is the result. Psoriatiform eczema on the palm. Slide ઉપર લખી. આ સેકન્ડ સ્લાઇડ છે. થર્ડ સ્લાઇડ છે. ફોર્થ સ્લાઇડ. ફિફ્થ સ્લાઇડ. સિક્સ્થ. I have given only Rs iodine. Rs iodine, chronic. કેસ નથી લાવવો પણ this is the result. અને આને એટલું બધું કડક થઈ ગયું હતું કે એમણે 2 વાર તો ઓપરેશન કરાવ્યું હતું. એનાથી કામ નહીં થતું. એટલે એને 2 વાર ઓપરેશન કરાવ્યું હતું. લેફ્ટી છે, 2 વાર તો ઓપરેશન કરાવ્યું હતું. અને પછી આપણી પાસે આવે છે. સો એટલે એને ઉપરથી કંઈક થોડું સ્કેનિંગ કર્યું છે, બધું કાઢ્યું છે. ડેબ્રીમેન્ટ.
Intercurrent to be specific to a repetition.
Yes.
That I want.
Okay. So intercurrent usually I give only one single dose, and indication is like Samir says that okay, use of antibiotics, especially that tetracycline extensively, and that is the only indication.
Medicinal history is most important in
Yes. કે કયું antibiotic even totopathy. Yes. Right. હવે થોડા વખતમાં એઝિથ્રોમાઇસિન ને બધી પણ મળવા મળશે આપણે. બરાબર. પોટેન્સી 200.
So nowadays lot of fungus that develop. We have different fungus, we have different remedies. They are already available.
Yes,
We are using a lot.
I have already having Candida albicans and Maniya albicans. So I use this Candida albicans 200. Sometimes આપણે જો ફંગલ ઇન્ફેક્શનમાં નહીં મળે, સ્પેશિયલી ફિમેલ ડિઝીઝ ફંગલ ઇન્ફેક્શન હોય છે તો ત્યાં Candida albicans બહુ સારી કામ કરે છે. લિંગવોમમાં
The worst condition is scenario of clinical practice is difficult to cure the limbo.
yes,
Mostly the tinea patients, every patient, chronic case will be cured,
Yes,
but
yes.
tinea will remain.
even this sentence is also told by our master Shankara. સંકલન સરે પણ એકવાર કીધેલું હતું કે ભાઈ fungal infection, tinea, it's very difficult to go. I sometimes advise to give external application also. Like to vapor. Kesianana, and I use one mother tincture. I use one mother tincture. Oleum Jack acilis. Cuma. Locally. Cuma. I advise to add 20 drops in his bathing water. So bath we need also external application and also internal application. फंगस ने तो तुम्हारे बद्धेથી મારવી જ પડે. સરકાર સર એવું કહેતા હતા કે એન્ટીબાયોટિક્સ નો બેક્ટેરિયાનો જમાનો ગયો, વાયરલનો જમાનો હવે થોડા વખતમાં જવાનો છે. Now the king is fungus. હવે ના પછીના 10 વર્ષ.
Another remedy is Sempervinum tactorum.
Yes.
Please use that. It is very wonderful.
Yes.
And ringworm nosol you can use.
Ringworm nosol.
Just single dose you can. Just 200 one dose.
What I usually the ringworm nosol you can you have to wait for 3 months. At least for 3 months. So don't wait before 3 months. Ringworm particular. So first medicine is
Cassia.
And Sempervinum is given in Boericke site if you can.
Sempervinum. Yes. Sempervinum kind of Sempervinum.
It is used also in ringworm.
Yes. Yes. I have get very good result with oleum Jack acilis Q. Right? You can apply also with mixture of the coconut oil. Then હું એને એડવાઇસ કરું કે ભાઈ ચમચીમાં કોકોનટ ઓઇલ લેજે, એમાં 5 ટીપા ના નાખજે અને પછી એપ્લાય કરે. રાઈટ? બાથિંગમાં પણ નખાઈ દેવું. બીજે કશે કોઈ તો પણ see આપણે યુઝ્યુઅલી હા હા સો જેનાથી સફરિંગ છે ને એ મટવું જોઈએ અને પેશન્ટને આઈડિયલ ક્યોર નહીં કે ભાઈ મારે ડાયાબિટીસ સારું થઈ જવું હોય, કેન્સર અને કેન્સરનું પેઇન સારું કર ભાઈ. રાઈટ? સો ધીસ ઇઝ પેશન્ટ વોન્ટ. અને જેને પેશન્ટને જે જોઈતું હોય એ નહીં આપીએ, જો ભાઈ ખંજવાળ તો આવશે. અત્યારે મને એવું લાગે છે કે મેન્ટલી તો બહુ ઇમ્પ્રુવ છે. પેશન્ટ તમને છોડી જ દેશે કે ભાઈ ખંજવાળ સારું કરીને મેન્ટલી તમને સારું લાગેલું હોય તો મને બી ખબર તું જાતે પેટ આ સારું થઈ જશે તો એમને પણ ખુશી થઈ જઈશ. આને સારું. સો વોટ એવર ધ પેશન્ટ ફીલ that is આને મને શું કીધું છે કે ધ પ્રેઝન્ટ સિમ્પટમ્સ whatever is present that has to be given importance. Right? So this is the cure. Potency, low potency. R7 6. Yeah, it is, but not much acting.
In very few cases, not in all the cases. Not in all the cases.
Low potency,
Low potency repeated dose.
3x, 6x you can.
Very, very wonderful remedy for the recurrent abscess. Recurrent abscess. Excellent remedy.
It's basically cold liver oil.
Staphylococcus remedy.
Basically Basically it is a cod liver oil. So whenever there is marasmus, you can give this volume check SOS. A case of what? Simple thing. Plain what? Clear. Warts on the nose. Clear. Medicine to badi છે પણ this is just a glimpse of the case. Acne treatments. Nodular acne can be common on skin. Dabba. Your case. So here, what I want to convey the lesson from this case is I had given silicea, ઘણા બધા આપે છે silicea, but it recurs. Sometimes it comes again. થોડુંક improvement થાય ફરી આવે છે. Here I give one very good important intercurrent medicine, and that is Staphylococcus. Yes, Staphylococcus.